for who you go red for. So make sure again that you text CI goes red to 22333. Then you can join and I will be able to read your message. For those of you who don't know me, my name is Jessica Cook. I'm with Heart of Illinois ABC, and we are going to kick off our program here in about 10 minutes. So I will be hanging out with you guys until then and occasionally reading a few words for who you go red for. So we have a wide variety already. Right now we have sister, grandma, cousin Katina, Janet, Erica, Kendra, my mom, Kathy, and Gigi. I know there's a wide variety of people. We have Carolyn as well that just popped up. Again, if you're just tuning in, please text CI goes red to 22333. I know you probably have your phone by you. Mine's right here. Of course, on Do Not Disturb, for the fact that our recording is kicking off here shortly. And another reminder to text CI goes red to 22333 and let us know who you all go red for. And I want to say hello to everybody who's joining us. Ashley, hello. Shelly, Heather, Tammy, saying that she goes red for Marcia. I apologize if I pronounced that incorrectly. But thank you guys. We have a lot more coming in. Going red for myself. I do find that one to be very important because sometimes we don't think about our own heart health. I know we talk about it all the time, but really a lot of us don't think about it until something happens. And we want to be proactive and not reactive to the situation. Many of you go red for children, patience, Stephanie, family, for women around the world. Penny, hello. Thank you for joining us. We have Stella. For those of you just tuning in, we've had a few more people log on. We have about 7 minutes until our program officially kicks off, but thank you so much for joining us. My name is Jessica Cook. I'm with Heart of Illinois ABC, and I will be your MC for today. We have about 7 minutes, so we want you guys to all text CI goes red to the number 22333 and let us know why you go red. You can also feel free to say hello in the chat box. We go red for Aliana, Stephanie, Kathy, my sister, Patience, children around the world, Erica, Gigi. There's a wide variety of who everybody goes red for, and this is awesome that you guys are participating. So we wanted to keep on coming in. Lynn, good morning to you. Melody saying that she goes red for her work sisters. Lynn goes red for her mom. Hopefully our program this afternoon will be a little bit of a bright spot for you all today. I can hear rain out my window right now. So if it's raining by you guys, hopefully this program will bring a smile to your face today. Anu Puma says, all women in my life. Thank you so much. If you're just tuning in, my name is Jessica Cook with Heart of Illinois ABC. We have a few minutes before our program officially kicks off, and we want you to tell us who do you go red for. You can text CI goes red to 22333, and that will allow it to pop up on the screen here, or you can leave your comment in the chat box as well, as I am checking those throughout the program. As far as who do you all go red for, We have Carolyn, Janet, Kyrin, Erica, Aliana, Katina, Stephanie, the world, Patience. We have Kathy and Stella, all women in general. Many patients. Your mom, your grandma. Lynn commenting that she goes red for Aunt Gladys and Aunt Bert. Thank you so much for your comment, Lynn. Going red is something that we all should be doing. You know, we should go red for women, and we're going to be talking a lot about it throughout our program this afternoon, and we hope that you guys enjoy it and learn a lot. You'll be seeing a story that I produced this week, and I hope you enjoy it as well. I met a open heart surgery survivor, and she was such a pleasure to meet, and has just a really impactful story. And I hope you guys enjoy it. That'll be coming up here in our program, which starts in 3 minutes. So if you guys haven't participated yet, we would like to hear from you. You can text CI goes red to 22333. And we want to know, who do you go red for? Janice says that she goes red for her grandson. Jody goes red for her daughters. I go red for my mom, my grandma, my future mother-in-law, my godmother, all the women in my life. And I'll include myself in that. It's never too early to start paying attention to your heart health. Definitely a conversation we need to have more and more. A few new comments here. We have Aliana, Beatrice, June, children, grandma, family, Kathy, cousin Katina. We have Janet. Thank you guys for all your participation here this morning. This is amazing to see. We all go red for somebody different, or we all go red for a common denominator in our life. Penny saying all of my family and friends. Although there are specific people in our lives that we do go red for, I truly believe that we should all go red for everybody. Heart disease and stroke really needs to be discussed. The more time I spend with the American Heart Association, the more time I'm learning about it, and it's really got me thinking over the past year. We have Kendra, some patients, children, Stella,
I want to be for my daughter what my mom has been for me. Her favorite phrase to say is, "Cindy's my best friend."
My family has definitely had heart issues.
I feel like I worry about her health all the time.
When we talk on the phone, I'm always like, hey, I just came from the gym. What did you call me for again? Like, she sees my daily routines. My mom is more health conscious because of me.
I've seen my mom transform when exercise was brought into her life.
I just want her to live the longest life she can live an amazing life. Mom, watch me.
Mom, watch me.
Mom, watch me. Mom, watch me.
Good afternoon, and welcome to the American Heart Association's annual Peoria Go Red for Women Luncheon, nationally sponsored by CVS Health and locally presented by OSF Healthcare and SEFQ. I'm Jessica Cook with Heart of Illinois ABC, and I am so proud to serve as your MC for today's event. Heart of Illinois ABC is a proud media sponsor for the Peoria Go Red for Women movement. I am thrilled to be with you today to celebrate, be inspired, and raise awareness of women's heart health. I know many of us are passionate about Go Red for Women and the American Heart Association because a woman in our life has been impacted by heart disease. Why do you go red? We want to hear from you. Let us know in the chat box. Jody says that she goes red for her daughters, Penny, all of my family and friends. Janice goes red for her grandson, Lynn for Aunt Gladys and Aunt Bert, also for her mom, and Melody goes red for her work sisters. And Yolana goes red for cousin Katina, Dawn going red for her daughters Julia and Jenna, Ashley saying myself, my family, my children, and women all around the world. Thank you all for your comments. We so enjoy hearing from you. So keep talking in the chat box throughout the program. We aren't in person, so let's make it feel like a Go Red community through the chat. Talk about what program you attended before the keynote, and we're really excited to hear. And in addition to chatting within this experience, we want you to amplify it on your social channels. We hope we inspired you to dress up a bit in red today and take a post. It is certainly post-worthy itself. Take a picture and share it using hashtag #PeoriaGoRed. Cardiovascular disease is the leading cause of death for women, taking one woman's life every 80 seconds. That's more than all forms of cancer combined, and it's on the rise, impacting younger generations of women. While nearly 80% of cardiac events can be prevented, 1 in 3 women live with heart disease and stroke. That's a third of our mothers, sisters, and friends. It's imperative we change this fact, yet disparities in care for women's heart health continue to exist. Our goal today, it's simple. We want to make history. Cardiovascular disease is no longer just an old man's problem. It impacts women of all ages, races, ethnicities, and backgrounds, yet women continue to be overlooked, symptoms dismissed, and significantly underrepresented in the life-saving research we need to treat, beat, and prevent heart disease and strokes. It's time to demand better when it comes to women's heart health outcomes. It's no longer just about sharing facts. We must join together and take a stand for our own health and inspire the women we love to do the same. We must demand to be counted, equally represented, and treated fairly when it comes to cardiovascular care. Our Watch Me Go Red campaign empowers women to get healthy and in turn encourage others to be examples of good health and well-being. Go Red is more than a moniker. We're here because women make a difference. They always have. There are many sponsors, supporters, and patrons that have helped make this event possible. But it all starts with one incredible, fearless woman saying yes to serving as the chair of this life-saving campaign, then working tirelessly to raise awareness and funds in our community for this incredible cause. It is now my honor to introduce the extraordinary chairwoman of the 2021 Peoria Go Red for Women movement. Please welcome Stephanie Petrie.
Thank you, Jessica, and thank you to everyone joining us today. My name is Stephanie Petrie, and I am proud to be the 2021 Peoria Go Red for Women Chair. My hope is that each of you leave here today feeling empowered and inspired to take action. Together with you, we can all live fierce, channeling heartfelt intensity into advocating, motivating, and educating people so they are empowered to live longer, healthier lives. The work of the AHA has never been more important. They are advocating for changes in the policies and environments that address inequities for access, nutrition, and quality of care, issues only exacerbated by the pandemic. But they can't do it alone. They need our help. And while there is still much to be done, there is much progress taking place. I want to share some examples of how the AHA is making an impact. Just last year, the AHA made a commitment to funding more women scientists. This past fall, leading women investigators were recipients of the first rounds of grant funding from Research Goes Red, an initiative by the American Heart Association's Institute for Precision Cardiovascular Medicine to engage more women in research. Starting now, you can help give families and friends more time with the ones they love by making a donation to support the work of the AHA. It's easy. Just grab your phone and text CI Goes Red to 41444. You'll immediately receive a text response with a link to a secure website where you can easily complete your gift. I would also like to take this opportunity to thank our sponsors for Peoria Go Red: OSF Healthcare, CEFQ, Unity Point Health, Clifton Larson Allen, Lexus of Peoria, and Heart of Illinois ABC. Behind all great work, there is a great team, and Go Red is no exception. I'd like to thank our executive leadership team. Your support and guidance is world-class and wildly appreciated. Susan Milford from OSF Healthcare, Diane Rowe from CEFQ, Tina Miller from Unity Point Health, Erica Wright from Touch, Kathy Schaefer from Stellar Systems, Anu Udavolu from OSF Healthcare, Kendra Moultrie from Alpha Kappa Alpha Sorority Inc., Nu Pi Omega Chapter. I know this year has looked incredibly different in how we live, work, and socialize. But what didn't change was just how amazing everyone turned out and showed up for National Wear Red Day on February 5th. I know we couldn't be together in person this year, but by wearing red, we came together as a collective force for awareness and change. Take a look at how Peoria went red this year. Thank you and enjoy the luncheon.
Thank you so much, Stephanie. The American Heart Association is honored to have you represent Go Red for Women in Peoria. Now I would like to introduce you to Matt Mamer of CEFCU. CEFCU is the proud sponsor of our Circle of Red. Take it away, Matt.
Making a difference in supporting our local communities has always been important to CEFCU. Community support is also essential in fighting against a woman's #1 killer, cardiovascular disease. CEFCU is proud to be the Circle of Red sponsor for Peoria Go Red. I want to take this opportunity to recognize all the Circle of Red members. These women have made a personal commitment to the American Heart Association. Circle of Red members are the most committed and generous supporters of the Heart Association's mission. They lend their voice, their influence, and their financial support to Peoria Go Red. To all the Circle of Red members, thank you for being a catalyst for the American Heart Association, helping them achieve maximum impact in equitable health and well-being.
Thank you to Matt and our Circle of Red members. Your dedication to our community and the American Heart Association is certainly inspiring. This year marks the 17th anniversary of the American Heart Association's launch of the Go Red for Women movement. Go Red for Women is rooted in raising awareness among women that heart disease is their #1 killer around the world. Yet, while considerable progress has been made toward this goal, women, especially women of color, continue to be disproportionately affected by cardiovascular diseases and underrepresented in clinical trials. That's a life-saving research that we always talk about, but we need it. We need it to treat, beat, and prevent heart attacks and strokes. Ladies and gentlemen, cardiovascular disease is coming for us. It's not only the leading cause of death in women, it's the #1 cause of maternal mortality, touching women of all races and ages. We've broken barriers and defied statistics, launching our Research Goes Red initiative alongside Verili's Project Baseline. Together, we will encourage women to sign up and participate in clinical trials and research. This is groundbreaking. Now we can do something to save the lives of the women that we love.
Because I might want to have kids.
Because of my hormones.
Because I'm pregnant.
Because it might cost too much to include me.
Because the results in men easily apply to women.
Because I'm a woman. For many reasons, women have long been underrepresented in research. In fact, it literally took an act of Congress to mandate the inclusion of women.
But there's still so much more that needs to be done.
And women of color have the most catching up to do.
I won't let history dictate my future.
It's time for change.
It's time for change.
It's time for change.
Cardiovascular disease is the leading cause of death in women.
It's also the #1 cause of death of new moms.
Not to mention that most pregnant women will take some kind of over-the-counter medication that's never been tested in pregnant women.
Even today, many women are medically treated based on research results of men.
Women are not little men.
Participating in research can help change these facts.
That's why I'm joining Research Goes Red. Go Red for Women's newest initiative that puts women in the driver's seat to accelerate scientific discovery.
You don't have to be sick.
You don't have to be unwell.
You don't even have to leave your living room.
But it's time we had more women creating solutions for women.
So watch me.
Watch me be counted. Watch me matter.
Watch me be represented.
Watch me change my future.
Watch me go red.
What a great way to support women in the community and around the world. The AHA is asking women across the country to contribute to health research. This is a research platform and registry for women. Through registration, you can contribute at any level that's comfortable for you. Clinical research, surveys, focus groups, there are so many different options. You'll also get exclusive updates and have the opportunity to test new technology. In doing this, you will not only take charge of your own heart health, but you'll be helping others. Last fall, the AHA announced our first studies for Research Goes Red. They did a weight study, focusing on weight changes in women during menopause, and also recruited experts to survey underrepresented groups in millennial women. All of the surveys focus on health concerns, wellness, COVID-19, health inequalities, fertility, and pregnancy. Do you support Research Goes Red? Would you consider signing up today and sharing the message? Let us know in the chat box. And if you're interested in joining Research Goes Red, be sure to register today. It's pretty simple. You just have to visit www.projectbaseline.com/studies/go red. Now we turn to the heart of our program. June is why we go red. 8 years ago, she had open heart surgery. And thanks to her talented cardiologist at OSF St. Francis, June was saved. Now we'll hear from June, her husband, and her doctor. A special thank you to OSF Healthcare and Heart of Illinois ABC for producing this story.
June Bellemare and her husband Brian live a relatively quiet lifestyle. That was shaken up in 2013. June says one night she felt really sick.
Couldn't stand up, heavy chills. It was so bad, my husband called the ambulance.
She thought she had a bad case of the flu, but it turned out to be much more serious. June had endocarditis, an infection of the endocardium, the inner lining of your heart chambers and valves.
I had a little hole in my valve. The doctors thought maybe it would heal itself. I went on a couple more years. I was okay, and then I started becoming breathless.
June says she wasn't one to go to the doctor, but with her husband's encouragement, she went in for a visit and was told the hole in her tricuspid valve wasn't going to heal.
Oh, I was scared. I was always healthy. Always healthy. I don't even have my tonsils out. I mean, I've not a broken bone in my life, a couple colds. I never got sick. I was really scared. I didn't want to do it. I didn't think it was as serious as they said. I thought maybe they don't know what they're talking about.
She was scheduled for surgery at OSF St. Francis Medical Center in Peoria in September 2018. She was only supposed to be there a few days, but there were complications.
So then the next day I went to see her in the hospital. She was fine. She was actually walking around. And the third day, that's when it all changed.
I remember being prepared for surgery. I don't remember anything after that.
And they put nitrous oxide actually into her system to get her breathing better. Then they had to induce a coma. So for like 2 weeks she was in a coma, and every day got a little bit better. But then some day, then it went down again. She wasn't doing too good. They told me that she probably, she might not make it and stuff.
Very, very supportive husband. I think he reminds me every time I see him in the office about that conversation too, because I think it left a mark on him. The heart team actually sat down with him to tell him how grave the situation was, and what the odds are.
Dr. Chetan Bardwaj is a cardiologist with OSF Healthcare. He met June in the intensive care unit.
She developed cardiogenic shock, which is basically heart failure to the point that the organs are failing.
Her kidneys and liver were declining, and June was on a ventilator.
It was a very rough period in that post-op state where we had to think outside the box to offer therapies and try to support her through that. But the remarkable thing is the resilience she showed, and despite all odds, recovered through all of that.
When she came out of a coma, June says she remembers being surrounded by bright lights and equipment.
I couldn't move. I didn't realize at the time how bad it was. I couldn't talk. I guess they did an intubation, so days went on, I got a little better, a little stronger. Yeah, I guess I was there for about a month.
June was sent to cardiac rehab. The Bellemare say they got through her health scare by keeping a positive attitude. Today, June has an inhaler and some daily medication and is active every day, walking around the neighborhood twice a day, along with eating right. She says she's made these changes so that she can be with her husband for a while longer. Changes Dr. Bardwaj encourages.
As I tell most of my patients, you know, we're clocking miles on the heart as we age every year. So eventually the heart does tend to give into all the abuse, whether it's coronary disease, whether it's heart failure that can happen because of uncontrolled hypertension. In these regions, there's a lot of poorly controlled blood pressure that is a big factor leading to heart failure.
He says it's important to exercise 20 to 30 minutes 5 days a week, avoid smoking, and cut out high saturated fats in your diet. And June's advice for you?
Make sure you listen to your body. Don't self-diagnose. If you're breathless, if you're getting a little tired, just go get a checkup. Go get a checkup, see if anything, if you're healthy, if anything is necessary. It might save your life. It saved mine.
Thank you so much to June for taking the time to sit down with me and sharing your story. By sharing today, you're empowering women to take charge of their own health and making a difference in our community. For women like June, for the women who just went into cardiac arrest at her desk from a heart condition she didn't know about, for the woman who was dismissed upon arrival at urgent care and told she's just being a woman and not having a heart attack, for the mother living with type 2 diabetes, caring for her mother following a stroke, for the empty seat beside us, where our mothers, grandmothers, aunts, sisters, and mentors should have been sitting, watching life's most precious moments beside us. For all of them, and for you, the 1 in 3 women here today who has or will battle heart disease, I want you to help me now. Draw a line here today. I want you to open your heart and make a gift to support the work of the American Heart Association so that more women are aware, have access to care, receive the best treatments, are fully represented in research, and have the opportunity to experience good health and well-being. We all want that, right? June's story is simply inspiring. And now we're at the segment of our event where we will ask you to open your heart and help fund the American Heart Association's life-saving mission and ensure that everyone lives a longer and healthier life. We're here today because we believe in the work of the AHA. We recognize the past year has been challenging for so many of us, but we believe supporting the work of the American Heart Association affects us all. Your gift today, no matter the size, matters. Text CI Goes Red to 41444 to make your gift. We will begin today by asking you to give us $250. You could help people who don't speak English with materials that help them learn how to lower their risk of heart disease and stroke. Here at the American Heart Association, we want to help healthcare providers in any way that we can. A gift of $100 could help provide healthcare workers with opioid education to recognize and treat an opioid overdose. Doctors will be able to recognize symptoms quicker and respond faster to anyone who's in need of help. I'm asking now, if you have not made your support known to the American Heart Association, to consider a gift of $50. Your donation will help provide 10 hospital discharge toolkits to stroke survivors and their families. We turn to our final level. Can we get everyone who has yet to donate to make their gift so we have 100% participation and support survivors like those you've met today? No gift is too small. These combined gifts will help fund the life-saving research we've talked about that will save and improve lives from heart disease and stroke. Cardiac innovations such as precision medicine will be closer to a reality, potentially improving the lives of millions of people. Thank you so much for all of your participation today. Thank you for opening your heart to the American Heart Association. Your generosity is inspiring. Go Red for Women is about sharing heart health facts. It's about making a commitment to yourself and the women in your life to take charge of your heart health and the heart health of those you can't live without. If you couldn't make your gift now, please consider visiting our website, www.heart.org/PeoriaGoRed, to make your gift today. Now we turn to the final segment of today's program. It is my pleasure to introduce to you the 2021 Peoria Go Red Woman of Impact. This new program brings together changemakers in Peoria to not make only a financial impact on the Go Red for Women movement, but also a direct impact on our community. Over the last 8 weeks, she has been working to inspire others to make heart-healthy choices and take the initiative to increase awareness of Peoria Go Red in the community. Congratulations to Ashley Whitlatch, our 2021 Woman of Impact. Ashley is a local nurse practitioner here in Peoria. When she isn't busy with her patients, Ashley enjoys spending time with her family and helping the community go red. She is also currently enrolled at Southern Illinois University Edwardsville, working toward her doctorate of nurse practice in conjunction with a Master's of Business Administration. I'd now like to introduce you all to our Woman of Impact, Ashley Whitlatch.
Thank you, Jessica, and thank you to everyone else for being here today. It's an honor to be the first Woman of Impact for Peoria. Go Red for Women was launched to address women's heart health. As a nurse practitioner and as a woman, I want to ensure that we all have the opportunity to live longer and healthier lives free from cardiovascular disease. I am proud to support the American Heart Association and make a difference for women right here in Peoria. I do want to give a thank you to my team for helping me reach my goal: Penny McNichol, Tara Barrett, Kiana Randall, Frank Coates, and Montia Wright. And I also want to give a special thank you to Kendra Moultrie from Alpha Kappa Alpha for nominating me as Woman of Impact. I look forward to continuing my support for Go Red and making a difference for all women.
Thank you so much, Ashley. Congratulations again. How exciting. You are a shining example that it's more than wearing red and sharing heart health facts. You've made the commitment to stand with the women in our community for the betterment of lives all over in the fight for heart health equality. Thank you for taking a stand and making real change. And now I want to ask you to make some real change. Tell us in the chat box, how do you plan to be a person of impact in our community? I've certainly learned a lot by being involved with the American Heart Association, and I'm going to continue to spread that message throughout our area in hopes that more women and men will know how heart disease and stroke can impact women. As we close our program today, I would like to thank you for joining us. What a great way to spend the afternoon. It's been so much fun celebrating the American Heart Association with all of you. Thank you for investing in the AHA and its mission and the people impacted by the organization's work. Have a lovely afternoon and rest of your day.
Getting back to this, to her, to family, to friends, to hugs. For people at higher risk of COVID-19 complications because of diabetes, high blood pressure, and heart conditions, the COVID-19 vaccine is an important choice. Consider it's the first step towards getting back to what you miss so much safely. Getting back to life. Set your heart on it. It's up to you. A message from the American Heart Association. Getting back.